Okay, and we are live. I'll give it just a second as folks are joining. All right, but we'll go ahead and get started. Welcome everybody to the Life as a Pre-Health Student panel. Thank you so much for joining us. My name is Nick Radmer. I'm a Senior Assistant Director of Admission here at Northwestern. I'm also currently a graduate student. I'm getting my degree in higher education here at the School of Education and Social Policy. I am going to turn it right over to Uday, who is one of the directors of our pre-health affinity group here with Northwestern's Alumni Admission Council. I just want to really quickly introduce myself and say hi. I'm going to be going off camera for the presentation, the webinar itself, but folks are going to notice there is a Q&A feature that we have in Zoom. If you do have any questions that are related to the actual admission process throughout the presentation, feel free to pop those in the Q&A. I will be monitoring that and answering those questions as we go along. But welcome. Thanks so much for being here. Without further ado, I will turn it right over to Uday.
Great. Thank you, Nick. So yes, as Nick stated, this obviously is if you're here for the pre-health event. You have an interest in whether it's medicine from a physician standpoint, or a dentist, or a neuroscientist, or nursing, or what have you. We've started this year, these affinity groups, or interest groups and affinity groups. This is obviously one of the interest groups that we have for Northwestern. For applicants coming in, hopefully to get at least a few questions answered, and maybe get some information on what it's like coming to Northwestern, having an interest in a pre-health or in a health career. I'll give you just a brief intro about me. I am by far the oldest person on this panel, which is okay. Age is just a number, but I graduated in '93 from CAS Weinberg. I was a chemistry major for about 12 minutes until I realized that I was not as good at chemistry as I thought I was, but lasted a little bit and then became an econ major, stayed pre-med. That was always the plan. Graduated in '93, med school downtown at Rush Medical College '97, radiology residency at Georgetown, finishing in '02, and then coming back to Northwestern and doing a fellowship in body and interventional radiology, finishing in '03. I've been at Evanston Hospital since. So I'm on my 21st year with Evanston Hospital in that group. I feel like I've never left Evanston. And I bleed purple in a lot of different ways. So actually, I think I'm pretty good to be running this. I am on campus all the time. My daughter's actually a junior, so I'm still on campus for a whole number of things. Anyway, so I'm going to go through, we've got 3 panelists and 3 students, and I'm going to hand it over to them, or 4 panelists and 3 panelists and 3 students, have all of them introduce themselves real quickly, and then we'll go through a few questions. And at least from my grid, I'm going to start with David. I'm going to just start at the top and go David and then Jerome and go from there. So David, go ahead.
All right. Hi, everyone. I'm David. I'm originally from Madison, graduated in 2020 from Northwestern doing a dual degree in violin performance and neuroscience. And then I did 1 additional year for a master's at Kellogg in their master's in management studies program. And then I went to, I'm currently a 3rd year medical student at the Medical College of Wisconsin. So that's in Milwaukee. And I am in the midst of figuring out what I want to do and applying to residencies in a short, 6 months, basically. So that's exciting. Yeah, I'll pass it off to Jerome now.
All right. Yeah, I'm Jerome. I grew up in Houston, Texas, and so I graduated from Northwestern back in 2014. I was biomedical engineering major, so in the School of McCormick, but I also, was pre-health during that time. I finished, so that's kind of 10 years ago now, actually. So I finished med school at UT Southwestern, which is in Dallas, and then did my residency and fellowship in Houston at UT Houston, which is where I work now as well as faculty. And I'm in neurology, and specifically I take care of mostly patients in the hospital, so inpatient neurology and stroke.
Great. Fantastic. Rachel, we'll go to you next.
Hi, Rachel Ellison. I'm from Deerfield, graduated Northwestern in 2010 from actually the School of Education and Social Policy. So I was human development, psychological services, and double majored in psychology in Weinberg with a certificate in civic engagement. Afterwards, I did Northwestern's the NUPIP, Northwestern Public Interest Program, and worked at a nonprofit for a year. And then got my PhD at DePaul in their clinical community program and ended up specializing in neuropsychology. So I did we call it clinical internship, it's residency at the San Diego VA in traumatic brain injury, PTSD, and COG rehab. And then went on to do my 2-year fellowship at Hines VA in COG rehab and neuropsychology. So I'm a clinical neuropsychologist. I see patients, but I'm also a faculty member at Rosalind Franklin University of Medicine and Science.
Great. And then our last, at least alumni panelist, will go to Savannah, and then we'll go to the students then.
Hi, everyone. I'm Savannah Kimball. When I was at Northwestern, it was Savannah Enders. I'm a classmate of Jerome's. I graduated in 2014, biomedical engineering, McCormick alum. I'm originally from Texas, outside of Austin. And now I reside in Los Angeles, where I did my residency. Oh, sorry, med school. Forgot that part. Went to med school, Indiana University, stayed in the Midwest, and then residency, University of Southern California at LA County. And now I stayed in Los Angeles as a practicing OBGYN.
Fantastic. And then we've got 3 current Northwestern students. We'll hear from them. We'll go Besa first.
Hi, I'm Hamza. I am double majoring in cognitive science and global health, obviously on the pre-med track. I am a 3rd-year junior. I'm from Minnesota.
Great. And then Sophia.
I'm Sophia. I'm a junior in the School of Communication, studying communication sciences and disorders. I'm on the pre-speech pathology track. I also have minors in psych and linguistics, and I am from New Jersey.
Fantastic. And lastly, Greta.
Hi, my name is Greta. My cat here, by the way, is Chai. Thank you all already for your patience. I know she's been in and out. I'm a senior from Columbia, Missouri, and I am actually also a dual degree student. I'm studying biology on the pre-health track to be pre-medical, and I'm also studying voice and opera performance. And I'm doing that in 4 years. So, yeah.
Fantastic. All right. So the way we're going to run this is we're going to run through some questions. I think some pretty good general questions for our panelists to talk about, give you, those of you who are attending, some insight into kind of decisions made and decisions thought about. And then we'll end with try to answer. I'm going to kind of keep track, as is Nick, of the questions that are coming through on the chat box. If you have any question, feel free to put it in there. We'll try to answer as many as we can. Those that are specifically admissions related, Nick will try to answer those because I don't think you want any of us trying to figure those answers out. But we'll start there. So let's start. So you've gotten the history or kind of the background of most of our, or of all of our panelists. Let me start with a good general question, which you've all seen on your application. Why NU? You know, there are a ton of places you could go, and especially with a pre-health career, a lot of places that will give you a fantastic education. Why'd you go? Why Northwestern? And I'll start with the alumni panelists first. Feel free to go ahead, and then we'll go through the students. That's something I definitely want everyone to answer. David, Jerome, Savannah.
Happy to kick it off. I still do the interviews for students interested in Northwestern, so I answer this question a lot. But growing up in Texas, I wanted to go to college out of state, so I applied like everywhere out of state, even though Texas has really good schools too. I ended up doing a summer program at Northwestern, and I just fell in love with the campus. I fell in love with the opportunity to learn from a lot of different colleges on campus. Top-notch colleges to not just get an engineering degree, but also their like arts and sciences, other colleges just thing. Sorry if my Wi-Fi is acting up. But the the campus, amazing. The colleges were awesome to offer lots of opportunities. The internship opportunities as an engineer were amazing, and being able to have that networking ability. I also was a cheerleader there, so it was nice to be able to go to a cool school and also be part of a nice sports program. So it just offered everything I wanted it to give. And also, if I didn't go to medical school, I would still have a consulting or go into business or anything like that.
Great. Fantastic. All of you newbies went to Northwestern when we actually had good sports teams. I did not, although I get to cheer for them now. All right, who else?
I can chime in next. I guess, a lot of similar reasons. So I, also came from Texas, and I knew I wanted to travel elsewhere, but I was looking at, West Coast, Midwest, especially for the really good engineering schools. That was kind of like my first thing. I really wanted to get good biomedical engineering teaching, but then at the same time have the resources for, pre-health track and like all the support to be able to go into med school right after college, which is the traditional track, but actually a lot of people these days don't go straight from college. But in any case, all that support was clearly there. If you get a chance to tour, then you can see that in person, but also through, events like this, you can kind of learn more about what that support is, through the advising office and also all of the student organizations that give you a ton of opportunities to, say, volunteer, do outreach projects, even travel across the world to, learn about medicine and kind of participate in the ways that you can, as a college student to deliver healthcare or even just, learn from others in the process. So I got to participate in all that, while I was at Northwestern and really tried to take advantage of it, which is something I always tell everyone. College is only 4 years, and you get to do things that you'll probably never ever get to do again. So that was one of the big things. Northwestern had all those opportunities that I wanted to try.
Great. David, Rachel, you want?
I would say to echo that, I found that Northwestern students just had diverse interests, that they weren't solely focused within their field or their major, that people had eclectic interests, and that was really fostered at Northwestern with the pairing of majors, and that students really engaged in extracurricular activities, and there were no shortages of activities or opportunities, domestic, international, like in the city, around the country, things that you could do across the year during breaks. And I found when I was on campus that those types of activities and experience really are what shaped my experience and shaped kind of my thinking skills and my interest for after graduation. I was involved with an organization called Camp Kesem. It was a camp for kids whose parents have cancer, passed away to cancer, free camp for kids to attend. And so it felt like you could make real impact as a student and do some really cool stuff. Non-traditional study abroads. And so it's just, you saw students doing all these things, even like one-off activities or opportunities, and really appreciated that kind of holistic, cultural, immersive experience on campus. And then learned it was, once I was a student, there was like even more opportunities than I even thought that there were. So I think that's kind of those are kind of my favorite parts about Northwestern.
Great. Great. Camp Kesem, I think the football team goes there every year, right? I think a number of the sports teams go and participate, if I remember correctly, with that, which is kind of cool to see. Anyway, David?
Yeah, basically what everyone said, I echo wholeheartedly. I guess I can take it from a like dual degree perspective. I was, music and science I wanted to do together. So I wanted to find a school that had both of those things. And I was able to basically pursue those at the same time with 2 degrees. And I found that Northwestern's degree programs were the best, like most well integrated. I think there were, all the schools sort of talked to each other, and it was very easy to have advisors that, had experience with people who, did all the different things, dual degrees, double majors, minors, everything, certificate programs. anything in between, basically. So it's by far one of the best schools, if not the best school, to pursue multiple different interests. And I think the last panel I was joking about, the thing we heard during my 4 years was like, and is in our DNA type of Northwestern
Right, we were.
sort of thing. So I don't know if I'm allowed to say that, but yeah, that's generally, you can do whatever you want, and they have all the resources to, help you figure out what your schedule's like. Or
Fantastic. Yeah. And was in our DNA, was for those of you who are joining in, that was an advertising campaign that Northwestern ran for a number of years. Unfortunately, I think some people got a little stressed out by it. So they kind of backed off on that, and they felt like all these students feel like they have to do something else, and they don't. But I think it's a great idea. And I think it is something that you see, and you're going to see this in all the panelists. And I'm very interested to hear what the current students will say, but there's so many things to get involved with. That and is in our DNA, even though I don't, like you said, David, I'm not sure we can say that anymore. But anyway, so a couple things that I think the panelists touched on is the diversity, really the flexibility that Northwestern allows. I'd love to hear what the current students have to say about that. So I'll let any of the three of you take it.
Start.
Great. Uh-oh. I can't. Hopefully yeah, looks like I'm not the only one.
How about now?
Oh, much better.
Okay, my computer mic was off. I'm sorry about that. I was saying, like, it's funny how David mentioned end is in our DNA, because I'm a tour guide and I also make the same joke when I tell people my major, because I'm a dual major. But the biggest thing besides the location, Lake Michigan, Chicago, besides that, the reason I chose Northwestern is the resources they have. So I'm like a first gen America. So like I have no idea how the college process look like. I have no doctors or no nurses in my family. So like completely going into blindly. And I had the opportunity to talk to a student, Purple Preview online, and she was pre-med, and we were talking about like the resources they have and the fact that the undergrad is very close connected with the medical school, the fact that they have so many opportunities, so many events to connect you with alums, to connect you with attendees in Feinberg, and the fact that all the pre-med advisors are well aware of all the resources they have. That kind of attracted me, because I really needed that guide, because I had nobody else to talk to. So the fact that they have so many resources that you can turn to, use all that's like the biggest reason why I chose Northwestern.
Great. Greta, Sophia?
I can go next. I chose Northwestern in large part because of the Communication Sciences and Disorders, or like CSD program. I knew I wanted to pursue being a speech pathologist, and I was really interested in that major, like to put me on that track. And specifically, I was really interested in Northwestern's program because there's a grad program here, and so we get to like actually be in classes with the grad professors, which is really nice. And then there's also a first year research program within the department, where we just like submitted our research interests and got matched with a lab if we wanted to do research, which was really nice because I knew I was interested in research, but had like really no clue beyond that on like how to get involved or like what I really wanted to do within research. So that was really exciting. I also think our advising really is good. I go to my advisor for like so much. She knows like obviously my undergrad requirements, but also has been through the process of pre-health students on multiple tracks a ton of times. And so she's been so helpful. And then also like extracurriculars too has been really great to get involved with. And I think Northwestern just has like all the support there, from like academics to extracurriculars, and the student body really is amazing. And so it's been a great 3 years, and I'm looking forward to my last one next year.
Fantastic. For those of you logging in, Sophia's background is probably one of the nicest shots of Northwestern. That's the Lake Phil. Hopefully it's somewhere you get to spend a ton of time on. Greta, I'll finish with you on this question.
Yeah, I actually was drawn to Northwestern at first because I did not know I was going to be pre-health in the slightest. I applied as a linguistics major and took one class and let that define the whole linguistics program for me, and I decided I really didn't like it. Spoiler, that was like a total fallacy, and the linguistics program rocks, but I just decided no time to lose and switched into biology. And I just love it. And what I especially love is that I could make that lateral transition without having to sacrifice the quality of my education even a little bit. It's so top tier here. I've never felt like I'm, compromising any part of my education. I've also never met a faculty member that is like remotely disengaged or unenthusiastic about teaching and helping. I feel like everyone on the faculty and student level is so involved and dedicated to their own education or that of those around them. And so it's been really rewarding, and you feel like you really reap a lot of benefits just from being in the space at Northwestern.
Great. So a couple things that well, definitely the students touched on. So I'm going to feed off of that for the next question that I've got for at least definitely the student panelists. And if any of the alumni have an answer to this, I'd love to hear it. Favorite class or class that really turned the light on or gave you an epiphany or something that you've had, at least as we've got 2 juniors and a senior on this panel. Is there a class that stands out to any of you that you could say, oh yeah, this was the class? Or it doesn't even have to be pre-health related. The fact that we've talked about how you can kind of do anything when you're at Northwestern. You can go to any of the schools and take a class. Anything that stood out? And since Greta, I think your mic was on last. I'm going to start with you.
Well, that's good because I have an answer. I
Perfect.
have a class that actually just wrapped up. It was the last 2 assignments I turned in this morning for the quarter. It was so fascinating. It was a religion course titled Medicine, Miracles, and Magic, Healthcare in the Middle Ages through Christian Lens. And it was just so deeply fascinating. The way that healing is viewed as like spiritual healing, but also that like priests and like local clergy people were also like practitioners of health, physicians, healthcare workers, nuns in convents were doing a lot of healthcare as well. It was so deeply interesting, and I don't think it's material that I would have necessarily been connected to had I not read that class. And the professor as well, Dr. Stewart, highly recommend her. She was so knowledgeable, but also so like passionate and real about everything. And I was a little afraid that I would go into like a Christian religion course and it would be stuffy. But she's like, very much with it, very like young and, I guess a finger on the pulse of the vibes of today. And so she's just such a breath of fresh air to be learning from. And I feel like I learned a lot from that class, even though I only had to write like 2 papers. So it was really big for me. Definitely one of my like top 3 classes.
Great. Fascinating. Beza or Sophia?
Yeah, there's like 2 main classes, one inside like pre-health and one outside, but the one like inside was intro to speech language learning and their disorders, which was basically intro to like the SLP field. But I think like that was really special for me because it went away from just like the science that we had been like learning that goes like into all of these disorders, but we were actually learning like what the different disorders that SLPs treat are, like how they're diagnosed and like typical treatment methods, and how like that interacts with like different patient populations and like different settings that you might see. And so that was really exciting. We got to do like observations as a part of that. And next quarter, I'm taking like the next level, which is like clinical assisting. So we'll actually be able to like assist in those things. And then outside of like the CSD department, I took language and gender, which was a gender studies and linguistics class. I recommend it to literally anyone who goes to Northwestern, no matter like what they're interested in. But it's basically a class that like talks about like the differences in like how men and women speak, the theories that led to that, and then like modern day applications. And it just makes you like really aware of like your language use, and just like the people around you and like social identities. But that was definitely a really cool class.
Great. Great. Beza?
This is a hard question because I have so many favorite classes I have.
Oh, that's good to hear. Pick one. Anyone.
Yeah, I'll pick like major 2, one in the pre-med area, one outside pre-med. Any class with Professor Mitchell, which the recent class I've taken is remixing quality of research, which is like I got into it not knowing what to expect, but it is a very interesting class because if you're conducting research, what are some things that you think about? And it's like it's more than research, it's knowing the history behind our current days, knowing the history behind how the research come to life, knowing the reason behind why are things happening during our world today. And it's like a huge part of the global health because you get to learn like what is determining people's health outside the non-medical area. So like it was really interesting to hear about from like people who went through the civil rights movements, who went in university during the civil rights movements. We get to hear about them, guest speakers, all that kind of stuff. It was such an interesting class. Outside of pre-med, I say like Latinx representation in film. I think it was just fun because all we did was just like watch different movies from like back in the day till in the highest, the recent one, and just talked about how representation changed or like how it harmed certain people, how it benefits certain people. And it was just a really nice class. I took over summer, so maybe that's why I like it, but we just watched movies and talked about it, and it was a nice class.
Always a nice breakaway from writing papers all day, I'm sure. How about our alumni panelists? I know I've got one, but I'll leave mine for the end. Anybody have a class? And if you don't, that's fine. Or if you don't remember, that's fine too. But if there's one that you'd like to mention.
I've got two. I'm sorry, I'm going with the two thing. And that speaks to like there's so many cool classes you take, and they're all so different that it's hard to pick one. So one was I think it's cool. You have the opportunity at an undergrad level in a lot of majors and programs to take graduate level courses. So I took a graduate level group dynamics course that was very Freudian. And the idea if you like sit in a room that like this happens based on where you sit and all the dynamics, and it was just very unique. And so it really has provided a different perspective and was different than any of the other theories and any of the other psychology classes I took as an undergrad or a graduate student. And then as part of the Global Engagement Summer Institute, I did an alternative study abroad and did nonprofit consulting in La Plata in Argentina. And so there was kind of a pre and post workshops that were course credits, and as part of that and learning a lot of community-based consulting work. And then we got to apply it in groups in country and then come back home and debrief and hear about everyone's experience in countries around the world doing nonprofit consulting work from a bottoms up community-based perspective. And so that was a really cool experience.
Great. Remember, David, anything in particular?
I could add real quick about a couple of classes. It seems like everyone is naming different ones. That there's just so many good classes. I don't know if it's still all the rage, but there is a class about Russian literature that was like really popular even when I was there. So that was a really fun class, a great lecture, and of course interesting books from Tolstoy and Dostoevsky. And then the other big class that I enjoyed is like an intro to existentialism, which is like one of the philosophy classes. So even though I was engineering, you have the opportunity to like really spread out and do whatever you want. And some of the most memorable classes are actually outside of your major.
Definitely, that definitely happens a fair amount. Great. For David, anything, or should I keep moving?
I mean, I can share. I probably have other
Anything,
classes that I took like outside of my major. Like Jerome said, like I took an intro to Islam class where we studied the Quran. It was very interesting. I think we took like the science of like the history of medicine and science, like prior to the 18th century. It was pretty cool. That one was really cool. Like music in the Holocaust, it was a musicology class that I took. So it's just like these very memorable classes just outside of what I would usually take. Those were probably the most memorable classes.
Fantastic. Yeah, I think all the panelists, and even I'm sure the current students could tell you as well that, you really, even though you're part of one school or one college inside the university, you really can take a class in pretty much any of them as long as there's space, which is really fantastic. And then the quarter system, which if you're on this webinar, you know enough probably about Northwestern to know that we have the quarter system, and that really lends the ability to take some extra classes that are not in your major, just because you've got a whole another quarter every year to take some classes, which is good, and you can kind of branch out a little bit. For the alumni, I'm going to kind of switch gears here a little bit. One of the questions on my list and some of the things I've seen coming up in the chat is any quick advice for people for students, incoming applicants going into a health career that you would give them any advice on kind of how to consider a career, what something to think about as they're coming into, whether it's Northwestern or they end up somewhere else, that you would give one or two pieces of advice.
I guess I can start if anybody. Um, well, I guess the two things that come on the top of my head are like exposure to a particular field. Like pre-health is so general. I think Uday talked about, dentistry, there's like PA school, there's nursing assistant, like medical assistants, there's obviously medicine, there's lab techs, you can go into research. There's also outside of that, like, I don't know, healthcare consulting if you really wanted to do that. So it's like it's so broad, so vast. So getting exposure and like exploring or like talking to someone in that field and saying like, okay, what is your life like? And can you see yourself in that? That's probably like the first thing. And then or like I guess that's the most important thing basically. And then like exposure, not only through talking, but also, when we talk about like medicine, there's a lot of shadowing that goes on. Like that's you're literally going to work and sharing a day at work with them. So can you see yourself in that? So those are the two big pieces that I have to say.
Right. Fantastic.
One piece of advice that I would give is do a lot of things that aren't medicine or health related, which I know is kind of a crazy piece of advice. But once you decide, like David said, there's so many things that you can decide between, but once you decide a small handful of things and you have your courses that you're going to take and you have that little timeline that's pretty well delineated, because when you get to your career, that takes up a whole lot of your time from the advanced schooling on. So follow your passions, like what Rachel did and did her nonprofit adventure. That sounds absolutely amazing in Argentina. So like travel, volunteer, do things that are outside. So the double majoring and music and those types of things are amazing. It also helps in your applications later, but it also helps with your patient care. So as much as you are exposing yourself to other things, then you know how to take care of diverse patients, you know how to connect with people, how to show compassion. So it really helps patients later on, and that's what we're trying to do anyway. So I would really encourage people to focus on school and focus on that track, but try to do as much as you can.
Absolutely. Absolutely. Especially, I mean, as all these questions are coming in, I mean, the classes you're going to take, no matter what you end up doing for pre-health, they're going to be tough. I mean, they're not easy classes. So you definitely want those things to walk away from, to spend some time when you're not studying. For me, it was marching band. I'm a self-processed, I'm a marching band geek. I was in marching band for 4 years. So that was my getaway from those classes. And it was fantastic. And it was allowed me to kind of meet a whole different group of people, as opposed to all the science geeks I was usually hanging out with. Drome, anything, or Rachel, anything?
Yeah, I can go next. Just so that we don't repeat, I mean, those are all great pieces of advice. I'll just add from a different direction. I really enjoyed research at Northwestern, and that's another way to explore. So besides shadowing or getting exposure to people's jobs, research is also a great way to explore, whether it's, SLP, cognitive psychology, the medical school as well. All of them are doing active research at Northwestern. So you can reach out to professors at any of the groups and join them, and that's a great way to also see how the day-to-day is and how the field is, if it's intellectually stimulating for you, if you really enjoy it, something that you would want to do for the rest of your life. It's a good way to see that. So that's one thing, and then just I think maybe some of the questions have been related to also like traditional or non-traditional tracks. And so just the advice that I always give is think about what you would want to do for the rest of your life, and then know that, once you're on that track, you may not have that much time to do other things. So if you really feel like you want to explore something else besides, say, psychology PhD, or if you are going to go to med school, that's going to be, your life for a long time. So if you do feel like you want to explore something else before you start down that commitment, then maybe that path for you is to have, a gap year or two where you explore other things. So again, that's really up to you.
Right.
Yeah, and I mean, echoing what others have said, I think doing the extracurriculars and the community-based engagement, adding on to what Savannah said, like that exposure to as many types of diverse communities, people, like that's going to make you a better clinician, a more culturally competent clinician, but also depending on what career field you go into and what type of degree program, having that community engagement and those leadership um, skills demonstrated on your CV or your resume is going to help you potentially get into that graduate program later. So some of those types of experiences, when they're put together, can be just as important in your post-undergraduate application package if you're not going to maybe a traditional medical school and you're going into a different type of program. So they can be helpful for a lot of ways. And especially what Jerome was saying about research, if you're looking at, a PhD level program, like a clinical PhD, you have to do research as an undergrad to get you into one of those programs. If you're interested in psychology, clinical neuropsychology, those research experiences in undergrad and post-bac are going to be what are going to make them break getting into those graduate programs later.
Great. All right. So let's see. Got a number of questions. Boy, I'm so glad I've got a great set of panelists who are answering all these questions in the chat box because I'm not able to get to them, trying to keep everyone on track. But it looks like, we've had a number of questions. Looks like about the rigor of classes at Northwestern. I mean, I think, as at least all the panelists here know, and probably most of the people who are logging in, Northwestern, we're top 10, which is fantastic. If you want to be top 15, that's fine too. I mean, but it's a tough school, and no matter what you do, whether you're doing pre-med and you're taking inorganic and orgo, the dreaded orgo class, or you're in CESP, or you're doing research that's heavily involved. I mean, these are kind of not things that are trifled with, I think, in my mind. They are tough, but I think they're all manageable. I mean, I think the students, I'm going to kind of go with the students on this one right now. They're there. I'm experiencing all of these classes and kind of managing how to work through some of these things right now. So it seems like a lot of people have asked that. So I'm just curious to see what the students have to say about kind of not only managing expectations, meaning your own, but just trying to be at the top of your game with 2,000 other students who are at the top of their game, and how that works, and how competitive it is, how collaborative it is. So I'll go to the students.
I can speak to that. I think generally it's a pretty collaborative environment in my experiences. I don't know, I'm not on the pre-med, so I'm not in all the pre-med classes. But I think for me, the classes that get hard and stuff, using office hours has been really helpful. We have an office called Academic Support and Learning Advancement that runs drop-in tutoring and peer-guided study groups. Peer-guided study groups have been a lifeline to me in some classes. I think using your peers, using your professors, and using your resources are three really big things. I also think structuring your schedule gets really important, of you don't want to take all of those pre-health classes that are really rigorous all together, that are all going to have exams at the same time. So that's working with your advisor to make sure you might be taking a class that's more essay based or more discussion based at the same time. And then managing your time. And then also something I found is having extracurriculars that you love to go to be a break, because if you let your classes take over all of your time, you'll always have more work to do. But the part of succeeding at Northwestern and being happy at Northwestern is being in your community here. And so I found that intentionally taking that time away in your schedule to be with friends or to be in clubs has been really helpful. And then also setting kind of a deadline of I will try my best. I will get as many resources as possible, but at a certain point I won't know the information, and that's going to be okay.
Sure. No, that's great. I mean, I think, like you say, stepping away is fantastic. Finding that outlet to walk away and to do something else is what you need. I mean, I think I have a junior in college right now at Northwestern, but one of the things we talked about, and I'm sure the students, definitely the alumni, I think, can relate, and the students may or may not be able to relate, is in the end, you only have about 3 or 4, at worst 5 hours of class a day. There are a lot of hours in college. You don't realize it until you step back and realize, oh, wait, I do have a lot of time. I have time for not just studying. You definitely have time to walk away, to do other things, to get involved, volunteer, to do research, whatever it is. But anyway, Beza, Greta, I'll let you go with the same question.
Yeah, basically Sophia said everything I wanted to say. It's very collaborative environment. When I came here, I was very scared of because everybody was like, oh, pre-med, competitive, everybody's gonna coming at you. But when I came here, it was actually the opposite. Everybody worked together. They make their own study groups on top of the pre-year guide study groups and the drop-in tutoring. At least my year, they were making study groups by their own, making group chats and like talking, asking questions each other's. So like it's very collaborative, which made me really happy. So it kind of took away the competitive part. So more of like, competing with yourself and trying to do better more instead of like compete with others and be like, I want to do better than the other person. Yeah, managing time was pretty hard first year for me at least. But eventually really it's really, really important when I say like use calendars as much as possible. Like I did not like use the calendars at home like in high school, but then I came here and I was like, I definitely need to use calendars. And like it's really important to like block up some time for your own self, like to take a break. It doesn't have to be with friends, it can be with friends, but sometimes I like take a break just by my own, just like quiet and I need silence to relax. So like prioritizing your mental health, that is okay. Like Sophia's, if you don't know the answers, that is okay, but prioritize yourself a lot more. And yeah, extracurricular activities. I'm in Taekwondo, so like that was my getaway. So last year when I was taking Orgo and Bio at the same time, which was very hard to do. My getaway was to just go and then do some kicks, do some punches, and I come back and I relax, take a shower, and I go back studying. So yeah, it is really important to prioritize yourself in this environment, especially when it comes to pre-med, knowing to schedule breaks for your own and schedule time with your friends. You can have social life if you're pre-med. I don't know who said like cannot have social life if you're pre-med. You can definitely do have social life as long as you can manage it properly.
Great. Greta?
Yeah, I think what I'm going to say is just an elaboration of what Lisa was saying, but I think a lot of college, just in general, but I guess also like relating to the rigor of classes is what you make of it. I know in reflecting, I think that my time in high school was very much like helped along by the teachers and stuff. And that's not to say that the faculty in college won't help you. It's just that you're going to be tasked with more responsibility than you're probably used to at that point. And it is on you to figure out what you're going to do with it. And so if you have a class that like your eyes were bigger than your stomach and now you're in deep and it's week 6 and you had a midterm last week, you have 2 this week and another next week, you have to hold yourself accountable in order to do your studying and turn things in on time. If you need help, you need to be the one to go to office hours because your education is your responsibility. And once you do reach out, there's like a well-oiled machine behind the scenes of all the faculty, and they will reach back to you with like 50 hands. And so there's absolutely so much like resources for you. You just have to be the one to ask for them. And so I think that's a big part of the rigor. But like everyone's been saying, and like I think I said in the Q&A, like typed out, the classes are so collaborative that I've actually like made lifelong friends from my science classes. The first person I sat down next to in Orgo the first day of fall quarter my sophomore year, she and I are still in touch. Her and her roommates came to my senior recital just a couple weekends ago. Like they're interested in me as a person and not just like for how I can help them study for their exams. So we're like actually friends, and I think that's pretty representative of honestly a lot of the environment around STEM classes and classes in general here. Is I think everyone just wants each other to succeed, and we all have each other's best interests at heart. I've never once been made to feel like I was competing.
Great. Let's see, we got a few minutes left. One of the things I want to ask, I guess the alumni panelists, now that you're out, obviously David's still kind of going through the process, but he's at least out from Northwestern, from undergrad, is connections. We all, one of the things I think that has become more and more important as the years have progressed is what does the alumni base look like? What are the connections that you make or have access to while you're at Northwestern, or just being a Wildcat or wearing purple and noticing somebody or making that phone call? Has anybody kind of experienced that, or things that they've thought about looking towards as a graduate at Northwestern? And I'll kind of open it up to, for the most part, the alumni. I mean, maybe the students have had some connections outside of class, but any alumni offhand?
I mean, I would say people very much connect with their Northwestern connection. And so if you meet someone else who's gone to Northwestern, it's usually more than just like it's not just in passing, like you have a conversation about it, and it's a bigger deal. I know I still get together with my Northwestern friends once a month. And so one of my friends moved out of state and they have kids, and now we're bringing the kids out there every year. And then I think there are also a lot of alumni opportunities for engagement. And so I'm a part of Northwestern's Council 100. And so do a lot of activities through them. There's a lot of networking. So I think there's relationships you build on campus, random people that you meet that you find out were a Northwestern alum that ends up like facilitating conversation or connections, or can help with networking. And then as an alumni, things that you can join that can help foster new relationships and networking too. So there's kind of opportunities at multiple points.
Great. You're on Council 100. I'm on NU Leadership Council. So kind of another thing that alumni are able to interact with, and I would say this to anybody who's on this thing, that, there are a number of events that occur, something to look forward to, actually. I know it seems so far away, but definitely something that'll continue afterwards, after you finish at Northwestern. There's a big base there. There's a big support network there. Jerome, David, Savannah, anything? Savannah, you're in LA. You're a little on the obviously on the West Coast from Northwestern, but I know there's a big alumni base out there. I've been to two football games out there in the past couple years, so I know there's a big Northwestern base out there.
Yeah, I'm pretty far from Northwestern, but it doesn't feel like it because there's still lots of purple out here. So I do go to some of those networking events that I'm blanking on the name, but when they have the different events in the different cities, I've been to that. We get together and watch different sporting events at various bars and things. But in terms of professional things, you can network with students that you went to Northwestern with, or even like traveling on vacation. I've met people that went to Northwestern, and then we connected on LinkedIn. The dean at Indiana University, where I went to med school, went to Northwestern. One of the deans, so she became my mentor when I decided to go there. So having that Northwestern connection beyond Northwestern at different places that I've been able to go to. Even some patients come to me and they saw in my bio that I went to Northwestern, and they're like, so I instantly trusted you. So it helps in various ways. But it's nice that the Alumni Association has a lot of opportunities to connect, and then things that happen organically can help you professionally or just socially too.
Right. Fantastic. Let's see. And I'm sure there are a lot of non pre-med med school people that are listening to this, but at least for one, because I'm sure there are a lot of pre-meds who are on this as well. The dreaded MCAT. Everyone's got to take it. I can see the looks on some of this, on at least Base's face, that, yeah, it's coming. It's coming. What resources? David, you're a little bit closer to that as well. Do you remember, what does Northwestern offer? What did you see was a strength coming out of Evanston to get ready for that exam? Exam and bases and Chris.
Yeah, we'll definitely get some of the current students' perspectives on that. At least for me, it's a little far removed. I feel like the MCAT has probably changed since I took it, but I guess overall Northwestern being, as rigorous as it is with the quarter system and everything, that I think anything that you get thrown at you, like the MCAT or that sort of thing, how to study for you because you kind of prepared for that for 2 or 3 years basically before that. I feel like there are a lot of different resources that you can take advantage of. I think I took advantage of my pre-med advisor, who was talking to me about oh yeah, you can use these Kaplan books, you can use this and these. This is not an ad for Kaplan, by the way, but different resources that you can use to basically boost up certain parts of your like MCAT, whichever parts. I think there's still 4 parts. Like, oh, you're kind of weak in the reading part. This is what you can use to supplement that. Yeah. Other than that, I feel like there was always some different MCAT study groups. There's like a pre-med group on campus that gives you a few resources too, and can be kind of your study buddies, accountability partners per se, to help you study for the MCAT. But it's definitely a beast for those who have to take it.
Definitely. Current students, what do you got?
I was studying for the MCAT last summer, and I canceled my registration, which is okay to do if you realize, like me, that you were not ready to take it. But I was studying last summer, and I had a friend from my physics class who I met in my physics class, and she and I would, you know, every Friday when it got closer to our anticipated test date, we would wake up together around 7 in the morning, make our way over to the 24/7 study lounge and do our practice full-length exams together, taking our breaks together. And it's really a marathon. Once you start studying and doing those practice full lengths, it is no joke, but it's so nice to have someone there going through it with you. I will also say this is not I don't know. This is not like baked into curriculum per se, but I got all my MCAT study books from a student who had just taken the MCAT, and they were well loved, but they were also heavily discounted. And I got the whole Princeton review set and the whole Kaplan set, plus online access for each for like a net cost of under $100. So I would say that's just a really sweet perk. Like I said, collaborative, everyone wants to lift each other up. And so it's really easy to find those resources, even in like semi-unorthodox places like Facebook Marketplace for those study books. So yeah, you can get a lot of help and feel supported in your MCAT journey for sure.
Great. Let's see what else. Basically, are you studying, or have you started studying, or in the middle of it? I would assume, right?
I am taking a gap year, so I'm kind of starting my studying like end of spring during summer, like Greta did. So I already have my accountability partner. We both are gonna take gap year, so we both gonna start studying at the same time. I was filing hard because I have friends who are currently studying for the MCAT and was taking the MCAT in April. So they were telling me like some of the resources they have, some smart ways to study for it. So I just got reminded of it because my friend was telling me each time when I see her, it's like, okay, this is the app you need to use. This is the book that helped me. This is the way to study. So she's basically preparing me for it when I start studying for summer. But I don't have enough information on it because I didn't start yet.
No worries, no worries. Yeah, gap years are a big thing right now. So it kind of changes the dynamic a little bit. One of the questions I have seen on here as well is a number of people have asked about research. I know I did a little bit of research as an undergrad. I think almost everybody on this panel has done some research, or is currently doing research and is still doing research. Anything that anyone wants to contribute in terms of, I mean, it's obviously very plentiful. We've got obviously the downtown campus and the Evanston campus. There are plenty of places to find research. As we all know, being a researcher as a student, you're cheap labor, which everyone is always looking for, and you're willing, right? You've got a very captive audience who are wanting to get into something. So I'll let anybody, if anyone's got any kind of anything specifically that helped them in kind of figuring out research, and not just here. I mean, research is obviously you could do in anything. So anyone?
Yeah, I would say, one way to find a lab to do research, sometimes people post officially, but otherwise you can go up to a professor after you like their class and ask them. And a lot of times they'll invite you to their lab meeting to shadow or kid, I'll read you stories in 10 minutes. Or no, baby, I'll read you stories in 10 minutes. All right, he's joining with or maybe someone else can go and I'll jump back in.
All right, no worries. Jerome, I think Jerome, you did a fair amount of research, right? And still are doing research, correct?
Yeah, I can jump in here as well. It's so cute. But yeah, so I did a lot of research when I was at Northwestern, and then continuing on, I basically in an academic position now because I enjoy research a lot, and it's kind of like half of my time these days. So I would say, a big thing to do when you're at Northwestern, just like, reaching out to professors, like Rachel said, is also just, Googling maybe, or maybe it's Chat GPT now, but you can just like look at the professors that we have in whatever your department is, or explore at the med school, at at the PhD programs and things, and see what the professors are actively doing. And then if it really piques your interest, you can just email them. And I did that a few times when I was in college, and I always got nice responses. The professors set up meetings with you. You can chat with them about their active projects and maybe think about which ones you could join, and then you just join it. So it's really nice that all the professors are so friendly and approachable, and it was really easy for me to set up things, and that actually like really encouraged me to stay in research and do it for the long term. And so now I can finally, like, several years later, I'm kind of paying it forward and trying to take students as well now. So eventually the opportunities you'll be able to start giving as well. Yeah.
Right.
I said, going back, I'd say not to worry as much about the exact topic being exactly what you're interested in, and more exploring research for understanding what different labs look like in different subfields and getting that experience. Because each lab is going to look a little different in terms of, the way it's run, what research actually, how it functions within the lab, the opportunities you have. And then you might be exposed to different things. You realize, oh, this is really cool. I am interested in this just by the virtue of being in different experiences. And I think in a lot of graduate programs after undergrad look less at the topic area and more, can you show that you were engaged, that you presented at conferences or publications, and that you can be productive and know how to engage in the lab and know about the process of research or developing questions. And there's a lot of ways that you can create specialized classes for yourself with your advisor, depending on what program you are, to do research for course credit, do a thesis in an undergrad. And so there's ways to build it into your course credit schedule, which is really nice too, with different faculty advisors.
Great. Yeah, I would echo that. It's not necessarily what the research is in when you first start. It's actually learning what research is to begin with, and how to conduct research and why it's important, and the different ways, the different labs, like you said. So it looks like we're getting close to the end of the hour. I think Nick may want to wrap some things up. I know people on the West Coast were starting to get a little late. And obviously, I think all of us on this panel could talk for hours about Northwestern. I think we all love it. That's why we're on this panel. But hopefully you got, all of you who are on this panel, you got something out of it. I think there are a number of other panels. I see a couple other questions that talk about other interests. There are a number of interest groups and affinity groups. I think Nick can speak to that, that Northwestern has created this year for the applicants. So I'm going to give it back to Nick and let him kind of wrap things up.
Wonderful. Thank you, Uday, and thank you everybody so much for your participation this evening and sharing your insights, whether you're an alum or a current student. Hope that this has been valuable, not only for you, but also for the folks in attendance here. So if we weren't able to get to your question, we apologize, and there were a lot. We tried to get through as many as we could. You are welcome as a student to look up on Northwestern's website. You can actually see a full list of the regional admission counselors that we have here. And if you do still want to reach out and learn a little bit more, feel free to reach out to your counselor. If you are a junior or a senior, you can also sign up for the Purple Preview conversation, which is an opportunity to sign up with for a conversation with a current student. And then finally, throughout the past several months, we have been uploading recordings of a lot of these panels with the other affinity groups too. So if you're curious and learning more about Northwestern, there's great ways to do that too. But I want to be respectful of everybody's time. Thank you all once again for taking the time to meet with us. Thank you again to the panelists and to Uday for moderating. And we hope to see you all on campus soon, and best of luck with your college search. Thank you so much, everybody.
Have a good night. Go Cats.
Go Cats.